I'm Jill Blakeway. I'm the clinic director at Yinova in New York City, and today we're going to talk about holistic fertility treatment. If you're coming in to have acupuncture the first time, the first thing I want you to know is that it's not as scary as it sounds. These are tiny little needles. They're hair-like. You could tie them in a knot if you needed to. So it's not like having a shot or lots of shots. They're really very small. Your acupuncturist will probably put 10 to 15 needles in you. You'll barely feel them, yeah? And then they'll manipulate the needles a little bit because that activates them. When they do that, all the connective tissue around the needle winds around the needle like spaghetti around a fork. And as it stretches, that point becomes more electroconductive. Wear loose clothing so that you don't have to take too much off. Don't have a great big meal before you come into acupuncture, and drink a bit of water afterwards and you'll be fine. One of the things that I think is quite interesting is that acupuncture can help women who don't ovulate to ovulate. Acupuncture can also increase blood flow in the pelvic region, and they can use thermal imaging and sonograms to show that. And so you can imagine when we're getting someone ready for IVF or when we're getting them ready to ovulate naturally, one of the things we do is we do points over the ovaries, and it increases blood flow, which in turn leads to eggs that are better resourced and nourished and a thicker endometrial lining. What we advise people do, if they have time, is to come in once a week for every week for 12 weeks before their IVF, if they can, and then to have acupuncture around their IVF cycle. And we suggest people come in twice a week when they're on their stimulation drugs, the follicle stimulating drugs. We'll time one of those in the day before retrieval. We then like to see people in between retrieval and transfer, usually the day before transfer, and then we like to see people the day after transfer. And that seems to work for our patients. We get very good results. So that's what we advise our patients to do. I like to see my patients once a week, unless they're actually in the stim cycle of their IVF, in which case I like to see them twice a week. One of the good things about coming to see us is that whilst we're helping prepare you for your IVF, we can also address some of those nasty side effects that people get, like bloating and fatigue and headaches and things like that. And acupuncture can be really effective at mitigating that. Acupuncture certainly helps build uterine lining, and we see that every day in the clinic. We have doctors who send patients to us with thin uterine lining, and we move a lot of blood in the pelvis, and sure enough, their uterine lining thickens up. Whether we improve egg quality, I think, is a little bit controversial. You'll see people who say we do. Here's what I think. I think we help every egg live up to its potential. And if it has the potential to be a 6 and it's operating at a 3, we can get it to a 6. And that often is enough. That's enough for it to become a perfectly healthy embryo. And so I see it that way, rather than as actually changing the egg quality of the egg that's already there. I think we're just helping it. We're giving it the energy in some ways. Imagine how much energy it takes for an egg to become an embryo. It's a big deal. And so there's a lot we can do to support an egg to help with that process. Massage can be very helpful to fertility, and there are techniques that are designed towards fertility. So for instance, in your area, you may well find a massage therapist who's qualified in Mayan massage, which is a sort of deep abdominal massage that has been proved to be very helpful for women's reproductive systems. At Yinova, we do a combination of deep abdominal massage alongside more Chinese medical massage, using acupuncture points and moving what we call qi in the meridians. But there are massage therapists qualified in fertility medicine all over the country. So here's what we teach our patients at Yinova when we send them home to do acupressure massage on themselves. The first point we teach them is called spleen 4. And we suggest this in the follicular phase, in the phase between day 1 of your period and when you ovulate. You find it on your foot, along the arch of your foot. You just sort of slide your finger along the inner side of your foot from the highest part to the arch. towards the big toe, and you'll find a little dip, a little depression just after the midpoint of that arch. You can see it there on the photo. And that's the point to massage. And you massage it quite deeply. Don't bruise yourself, but, give it some pressure. And the other one I would suggest that goes along with this point spleen 4 is pericardium 6. That's on your wrist. You locate it by looking at the inside of your wrist, make a fist, and you'll see that you have 2 tendons going along there. Actually, some people only have 1 these days. We're evolving, but most of us have 2 tendons that pop up. You go between those 2 tendons and you just go along 3 finger breadths, and there's another little dip, and you press that. If you do those 2, one after the other, you're activating a meridian called the Chong meridian, and that goes straight through the ovaries. And so although those points feel rather a long way away from your ovaries, they are in fact really effective for your reproductive system. So in the follicular phase, that is what I would do. And then after you ovulate, I have some other suggestions. There is a point called kidney 3. It's on the inside of your ankle, in the depression midway between your ankle bone, which is called the medial malleolus, and your Achilles tendon there. You can see it on the diagram, and you just press on that point there, kidney 3. And then I would pair that by following up with stomach 36. You can see that on the diagram. What you do is you feel for the bottom edge of your kneecap, and you place 4 fingers along the lower leg so that your pointer finger is touching the bottom of your kneecap, and your pinky finger is resting on the outside of your shin bone. And that's where stomach 36 is located, right under your pinky finger there. Acupuncturists are these days well qualified. They're licensed in almost every state now, and that licensure means that they've had a certain standard of education. It's usually 4 or 5 years. People do a 4-year master's or a 5-year doctorate. You can also look at a board called ABORM, which is the American Board of Oriental Reproductive Medicine. They qualify their members, take extra exams, and are qualified in fertility medicine, and they have a directory on their website that tells you where their members are. But bear in mind that that's relatively new, and a lot of older acupuncturists like me predate all of that, but we have a lot of experience. So look for someone with some experience in fertility. It's a very specialized part of Chinese medicine who has a good local reputation, and someone you like. Yeah, it's really important, I think, that it's someone you feel comfortable with, and you don't feel lectured or, shamed in any way. I aim to make my patients feel really safe. I think people only heal when they feel safe and cared for. So look for someone who makes you feel safe and not judged, and isn't over-promising and under-delivering.